Welcome back to the Pelvic Pod, proudly brought to you by Continence NZ. I'm Jen Bainbridge and we're back again to have another conversation that so many people are embarrassed to have. It's about bladder and bowel health, but we're here to normalise it. And today we welcome Becs Dodson, who is a musculoskeletal and sports physio who actually works with pelvic health, pre and postnatal care, and she also does a huge amount of work with sportswomen, so that's going to be a great conversation. She has trained in manual therapy, clinical Pilates and acupuncture, and brings a holistic lens to how she treats the women that she sees. Becs believes education is just as important as treatment, and she wants you to be performing well, staying strong, and hopefully feeling great. Welcome, Becs. Thanks so much for joining me.
Thank you. Thanks for having me.
It's great for having you here. So you're trained as a musculoskeletal and sports physio. First of all, what led you to want to focus on pelvic health?
Yeah, so I worked in sports and sort of musculoskeletal, more traditional physio for about 10 years and over in New Zealand and the UK. And then when I was in the UK, I just started to see a few more postnatal women trying to get back into sport and exercise and seeing lots of niggles and things going on. And then got married and had my own babies, and that just sealed the deal of the interest in sort of why this hasn't been a part of the way I've thought about patients' rehab and before in the past, and so really got into pelvic floor.
There is so much that can happen to a woman after having a baby, but also before, and so you're there before and after.
Yeah.
But first of all, let's talk about the sports thing, because that is obviously a really big part of your business. So you're working with top netballers, the Black Ferns. Tell us about the bladder issues you're seeing in these women.
Yeah, so like you've said, it's always used to be thought of an old lady's problem or maybe after having a baby, but we know the rates in athletes are really high, bladder issues, and it's just sort of now starting to get to a space where we can talk about it, and we see, like in the general population, all sorts of issues, but we do see what we call athletic incontinence, which is where they're leaking with those high-end activities when they're putting the full force in, or perhaps at the end when they're fatigued with their sport and exercise. And then the other issues, like we talk about with the other continence things, urgency, frequency, constipation, and they do have an effect on performance, and they do have effect on their well-being and the way that they train. So it's a really important sort of symptom that we can address with them.
What's causing that in women who are, well, especially women who haven't had children?
Yeah.
What is it, this hyperactivity, or what is it?
So I think it's definitely multifactorial. Obviously, we see it more in the sports that are high impact, so it's obviously just a forced load impact pressure on the bladder, so all that jumping, landing, straining, but also pelvic floor is part of the core, and it's an essential part of the core. But when you're talking about strength and conditioning and traditional gym programs and traditional sort of programs that these athletes are training for, pelvic floor is not really in there. It's not sort of brought in as part of what they're training. So it's often a muscle that's a bit neglected. We know there's lots of hormonal components as well, and there's times in our lives, postnatal, postmenopause, when we may have low estrogen, and we know that estrogen affects the bladder a lot. And these athletes, when they're training hard, they sometimes are at higher risk of not fueling well, and when they're not fueling well, it can start to affect things like estrogen and the reproductive cycle, and they can be more at risk. So I think there's lots of little things that come in that make them significantly higher risk of having these issues.
This is one of the key things I've learned from doing this podcast, is that estrogen affects the bladder. Never heard that before. Ever in my life. So that is such key information.
Yes, absolutely.
So then we think about that, and then we look at younger athletes. You're also seeing bladder issues in younger hypermobile athletes.
Yeah, absolutely. So I think like the rates for gymnasts and trampolinists are 80-90% of young girls leaking with these extreme movements. And I think, again, the tendency for these sports, if you're hypermobile, lean and flexy, you're going to be good at that sport, so you're drawn to that sport. But hypermobility on its own, that extra stretchiness of tissue, makes continence even more complex, because the tissue is going to move more, the urethra is going to drop more, the connective tissue is not quite as supportive, it's more stretchy. And so then again, they're doing high impact sports on stretchy tissues, and they may also be the ones that are under fueling a little bit with the leanness requirements for some of their sports and activities. So again, they're sort of a higher risk group.
So they need to be seeing you more than ever, really, don't they? And these younger girls.
100%. And really exciting that my colleague Neve and I managed to do a talk to all the gymnastics coaches in New Zealand at their conference, and they were just relieved, absolutely relieved to be having the conversation, because they didn't know how to approach it with the child or with the parent perhaps, or if they were getting it wrong or what was going on. So to understand the mechanisms behind it and that's something they can do was a real real relief.
So that, because I was just going to say, what do we tell these? Because probably young girls aren't going to listen to this podcast, but mums and coaches and PE 100%. Teachers and that sort of thing. 100%. This is how we get this information out there with this education. And this is so, I really want to share this podcast around with teachers and stuff like that as well, so that people understand that younger women are dealing with this problem 100%. As well.
So I've done some talks at some schools, which has been awesome. Cool. And a young group of girls, 10 to 14 at Pakuranga Athletics last night.
Did you?
So, that's amazing. And their little faces. So we're getting there. We're getting there because we need them to know it early, not later in life when it's 10 times worse.
Well, a key issue with this topic is that it's embarrassing to talk about, 100%. Isn't it? 100%. Especially you get a teenage girl, she's awkward. The last thing she's going to go is, hey, by the way, I actually really need to pee all the time. Yeah,
and that's where we sort of really try and bring in the education on how it might be affecting their performance, because that's going to be a bit of a driver for them if they know that, it might be holding them back, or if they get the pelvic floor better, that might actually help their performance rather than just going around the continence side, but making them realise it's an indication something's not right with their core, and their core's important.
Yeah, and so with those younger girls, we're probably not going to be looking at these surgeries or Botox or medications. No. So they really need to come and see someone like you,
and that's what my dream would be, like that they'd understand that's a muscle like any other muscle. If they had a problem with their calf, they'd tell their coach, or if they had a performance issue, they'd tell their coach. So if we can get an environment through schools and through teams where education's on the wall, even if it's subtle and that it's a thing, and so they can come and bring it up and sort of feel not as embarrassed to bring it up, and that other people will know about it and won't be shocked because it's been around, in the environment, then we can sort of, let them know they can strengthen that muscle or stretch that muscle, whatever the problem is. It's just something that we can work through with them. It doesn't have to be embarrassing and scary.
Yeah, we really need to normalise that conversation with younger women. But I mean, another really important, group is mothers, and pregnancy and recovery is such a big part of your work, isn't it? And postnatal injuries, how are they caused? How are they preventable? Where do we start with that?
Absolutely. It is, and this is the time that we do know that pelvic floor is under a huge amount of strain. I mean, in pregnancy itself, just the weight of the baby, the hormone stretchiness, all the organs and the tissue, all the nerves are under pressure. So even without a vaginal birth, you can develop pelvic floor issues and prolapse and incontinence issues after birth. But we do know there are some risk factors for vaginal birth, and that's babies bigger than 4 kg, pushing for more than an hour and a half or 2 hours, and needing the use of forceps. So in regards to how can we prevent that, obviously exercise and activity is huge. So we know that with the recommendations are 150 minutes of moderate intensity exercise, throughout the week, twice a week resistance training, and daily pelvic floor, and that those factors can really improve those birth outcomes. And a healthy, strong pelvic floor is also going to be one that can move and relax and release and manage the holding of the baby in pregnancy and manage the birth a bit better.
Yeah. What about women who are having a really uncomfortable pregnancy? Is walking enough?
Yes, and that's where we look at what else can we do, because sometimes back pain, pelvic pain can stop them. So getting in the water, exercise is amazing, and just being able to modify what they do, so they are keeping active, they are keeping everything moving, and they are using their muscles.
What does a prolapse feel like?
So it can vary. A lot of women will say they feel something in the vagina that just doesn't feel like it should be there, or like a tampon falling out, or sort of a sensation of a bulge. Others can be a bit more subtle, and they're just like, I go to the toilet, I don't feel like I empty, I have to go again because it's sitting low and they can't keep going, or they can't pass a bowel movement. So there can be a range of symptoms that go with it, and it can be not necessarily tied up to the level of the prolapse. Sometimes mild symptoms can feel a lot to someone, mild prolapse, and sometimes big prolapses felt too much by some women. So we really go on the combination of how bothersome it is and how it looks.
Oh, so fun, isn't it, being a woman? What's the absolute best thing that women can do postnatally for their pelvic health, bladder, and overall recovery?
I would say sleep. Rest and sleep.
Really?
Sleep is so much evidence on how much sleep helps your tissue healing and tissue recovery. And with regards to when you're resting and sleeping, you're taking pressure off the pelvic floor. When we're first standing up, lifting babies, lifting toddlers, you're putting a lot of pressure on a muscle that's just undergone a bit of trauma. So definitely rest. From a pelvic floor point of view, I would say breathing. A lot of women after birth, you feel really disconnected to your abdominal muscles, which are really stretched, and you might want to suck them in or hold them in all the time, and that actually puts quite a strain on your pelvic floor. It makes it hard for it to engage. So just relaxing, sometimes wearing some gentle support garments, not too restrictive, but gentle bit of support, so you can actually actively relax your tummy. That'll allow you to breathe nice deep breaths. The pelvic floor is getting some nice gentle activation. And the number one thing we say is a technique called the knack, which is if you have to lift your bubba or if you have to lift your toddler or something, try and engage your pelvic floor first before you put the pressure of the activity or the lift, or before you cough or sneeze. just so there's support in there.
That's a good point, because and again, women are focusing so much on flattening that stomach, aren't they, after the baby? So all of these things you're saying are very, very, very interesting. So when someone comes to you with a postnatal bladder issue, how do you treat them, and how long till you see results? What do you do?
So we see all sorts. Obviously, continence issues. We see frequency, urgency issues. We see prolapse issues. So it really depends on the type of bladder issue, and it really depends on the cause of the issue. Was it the pregnancy? Was it the vaginal birth? Is it damage to the muscles? Is it damage to the fascia? Is it damage to the nerves? So that's always in there. But I know it's a horrible answer for someone to say. It just depends. And so I sort of try and relate it to what people know. So like I said, if you've got a mild ankle sprain, a couple of weeks, you strap it up, support it, strengthen it back up. If it's a bit longer, it will like be 6 or 8 weeks. If it's a big injury, like ACLs are out for 6 months when you rupture your ACL. So depending on the state, I just sort of say we need some tissue, we need some support, some tissue healing, and some tissue strengthening. Obviously, these poor mums are sleep deprived. If they're breastfeeding, they've got that low estrogen. They're up against it from a healing point of view. So the time frames can extend out a bit. And so I just tell them not to beat themselves up, and it will get there, and slow and steady, and
I need to tell my daughter that. She likes to sit up late at night when the babies are in bed, and I always say, you need to get your rest. But I need my me time.
I know, it's a hard balance. It's a hard balance.
But also, that's detrimental to your health, not sleeping.
But honestly, the sleep is huge.
Unbelievable. So you practice internal pelvic release, which I had never heard of before.
Yep.
What is that? Does it hurt? It sounds like it hurts. And why would you do it?
So again, it's just a normal muscle. And so we would do muscles, massage and glutes or hamstrings if they're a bit tight and they need a bit of assistance to sort of lengthen. Yeah. So it's a similar sort of concept. I wouldn't say I do heaps of it, but I certainly is one of our tools in our toolbox. And so again, where the pelvic floor muscles sit, one of the easiest ways to probably access them is internally through the vagina. And if there's tenderness, or if there's a painful point that feels better after some massage and release, we can do those techniques and teach women how to do them at home. Again, it doesn't have to be the way we do it, but some people find it really beneficial, and it is an option for us.
I never thought about that.
Yeah.
Explain the connection between hip function and the pelvic floor.
Yes, so the pelvic floor sit at the base of the pelvis, and some of those deeper ones are basically right next to some of the deep hip rotator muscles, so right beside them. And tissue's all sort of gently connected by fascia and tissue, and so they have a very close anatomical sort of relationship. But they also do similar jobs in a force and a shock absorbing sort of capacity. So when you're landing from a jump, you need good strong hips, and you need a good strong pelvic floor to absorb that landing. We also notice that if someone's got a tight pelvic floor, or tight hips in particularly, a lot of the nerves to the pelvic floor pass through and close to those hips. So if they're very tight and restricted, it's much harder for a woman to sort of work on a relaxed pelvic floor, and it also can compromise some of that blood flow to the nerves. And so if we can improve some hip mobility and hip strength, we often get improvements in the pelvic floor function as well.
What's the easiest way we can improve our hip mobility? Is it yoga?
We give them some nice yoga poses. Again, I get them self-massage on the foam roller or a ball. Main thing is that I always say to my patients, you spend 20 minutes stretching, but then the next 12 hours you're sitting in a slump position or with your legs crossed all tight, you're not going to get an improved range. So in the day, looking at how you're moving and what positions you're doing and how to optimise those on top of the stretching is going to sort of get you there.
Yeah, right. So another thing that you do, which I again had not heard of, is clinical Pilates. How do you incorporate that when it comes to the bladder?
So I've trained in traditional Pilates, and I love Pilates, I love yoga. I would say I sort of use a physio lens from my anatomy and my injury prevention skills to sort of modify some of the more traditional exercises in a little workout to either encourage certain other muscle groups to work or to reduce pressure. So I'd often put a little ball or a sit fit under someone's pelvis to take pressure off the Pilates, so it's lifted up, off the pelvic floor and bladder, so it's lifted up. Or I might change the head position to look how their ribs are to make sure we're getting the best co-contraction. Legs and straps, we might not do the traditional way, we might do something a little bit different just to open up a certain muscle area a bit more. So more of a rehab focused.
Heavily guided.
Yeah,
I love
absolutely.
that. I really love that. A lot of us are getting into weights in our perimenopause years. I definitely am, which is great, but also have terrible bladder problems. So what can we do to protect our pelvis when we're lifting? What's the best, other than holding on or Kegels? What is your advice?
So we do know, like a lot of women now go to the gym, great, it's exactly what we want, but we need need them to be prepared for the fact that weightlifting will increase intra-abdominal pressure and it will put pressure on the pelvic floor. So if you can't meet the demands with your pelvic floor, you might run into trouble. So we don't want to discourage it, but we just want women to know. I think there's a recent study that came out that of these heavy lifters saying that 70% thought it was just normal. That's just what happened when you lifted heavy, that there was nothing you could do about it. So that's a step we need to change, because I've seen lots of powerlifters and lots of CrossFitters, and they've lifted better, lifted heavier, and been stronger from incorporating pelvic floor rehab. So it's a win-win, They're reducing strain on their pelvic floor and bladder, and they're lifting better and their technique's better.
What about those weightlifting belts that a lot of people use?
Yeah,
Are you a fan, not a fan?
Not a fan in a pelvic floor sense, I guess, because it very much restricts breath and pelvic floor co-contraction. But there's often, as long as you're mindful of what's happening and trying to create support in there as well, life isn't just pelvic floor, I get that. There are people that are competing. It's a really important part of the way they do things. I just make sure that they know what that pressure might be doing and how can we encourage pelvic floor to work its best for them.
Okay. Something that really got my interest when we first spoke was that back patients nearly always have bladder or bowel issues. How is that? So people complaining sore back. Tell me about that.
And that's been my journey, coming from a musculoskeletal physio who always asked and treated thousands of backs without my pelvic floor knowledge. Now thinking, why did I not ask about this group of muscles that sits right there, right next to the back, and has such an influence? So I think it's in females in particular, which I think is something like 90% of females with back pain will have some symptom of pelvic floor dysfunction, because you can't isolate out an area of the body and not have the muscle groups around it being affected. We think if every other group would look at all the muscles around your knee, we wouldn't just look at one. And it's just because it's been that taboo area, and we haven't trained as well in it historically. It's something we do after physio school. You do more research and study into it, that it's sort of been left out, and now we're starting to realise, of course we're going to need to ask about that, because if the pelvic floor's got a problem, that's going to affect the back. So we're slowly getting there. So
if we've got a sore back, we should definitely be wondering if our bladder or bowel's having a problem.
And it's not always, but there's normally a little component, and the more I'd always explain why I'm asking these questions, because it might sound a bit weird, but I say this is a pelvic floor, this is your back, they sit right next to each other. I want to check if there's anything going on with those that might be contributing. These are the symptoms that sometimes you can have. Do you have any of these? And they're normally pretty happy to discuss it.
Another thing we discussed in our pre-interview was the relationship between eating disorders, conditions like endometriosis, and bladder issues. So speak to us that a little bit.
So the endo has probably multifactorial again. So obviously it's a pain-driving condition, and like when people have headaches, we know their traps are really tight, and is it chicken egg sort of thing? Obviously pain's going to drive tension. Endo also tend to have high estrogen. We're talking about these hormones again, and that's very inflammatory. The eating disorders comes under this low energy availability, the REDS, which is called relative energy deficiency in sport, which is when it's in a sport context, but you can have it outside of a sport context, particularly in young female girls. Social media, body image pressures, if they're not fueling well during adolescence and teenage years, your body needs so much fuel just to live. You're growing, your brain's growing, you're doing all these things, and if you're exercising on top of that and not fueling enough, your body basically says, I'm not coping, I can't do anything extra other than survive, and it shuts things down, and one of those things is your reproductive system. And so the signals to stop you ovulating, stop having periods, and as a result of that your estrogen and progesterone levels drop, and we know again the continence issues associated with low estrogen. So it's a really common, as I say to the girls and the athletes, like I think if you have that REDS, that low energy, you're twice as likely to be leaking. And we know period tells us that your body, if you suddenly stop having periods and you've had them regularly, that's a big sign something's going on. But if girls are on contraception, you might not be getting periods, so you can't just rely on that. We rely on mood and how you're performing. But leaking suddenly starting, we might be thinking, okay, well, what's happening with the whole body? How's your energy systems as well as just pelvic floor?
Let's bust some myths. So I go to the toilet all the time, and apparently I shouldn't do that. I should be holding on. Is that right?
Well, holding on to extent. We don't want you holding on all day. But yeah, I mean, if every now and then you go just in case, totally get it. But if it's a routine habit you're getting into, you start mucking around with the nerves. It tells your brain when to go. And then you start finding you're not filling your bladder as much, and then your bladder starts to reduce the capacity it can actually have. And then you actually do need to go all the time because it's got a small bladder, and it's this vicious cycle. So we do say, yeah, definitely we don't want that happening on an ongoing basis. So it'd be normal to go for between 4 and 8 times a day. Yeah,
dear.
Yeah. And maybe
I won't
once
tell you how
at
many
night.
times I go.
I know. Oh, I know exactly. But that's the thing. If people don't know what normal is, and that's been them their whole life, that is normal for them. But when they don't realise that perhaps it might be starting to create longer term issues or other issues, you don't know that you want to start trying to change it. So I know we just give people the education about what normal is. It's going to be dependent on what you drink and what you're doing and all those sort of things. But you should be able to go 2 to 4 hours without needing to go, and you should be able to go on your own time and not have to race up.
So so to start with the bladder training then, that's what I need to start doing. So just holding on that little bit longer to start with. Yeah. And then that's my first starting point, other than having a very important appointment with you, which I'm going to do. So that's somewhere to start with for people.
It is, but we use bladder diaries quite a lot, where we get people to model what they're drinking, what they're peeing. Because if someone's going really regularly, but they've got 400, 500 mils, you can't tell them to hold on because they're going to need to go. So then we're like, you're drinking way too much. So we need to
work out. Next thing I was gonna ask.
How much they're drinking, and is it enough? Is it too much? Before we muck around too much with the distraction techniques in case they need to reduce the volume first.
Because I think we are drinking too much water, aren't we? And I've got one of those enormous,
I love those memes with the massive drink bottles and the teenagers, and you're just like, it's the most hydrated generation in a long time.
Yeah, and I fill it so many times a day. The other day I thought, this is going to be about the 6th time I've filled this, and it's about a litre in it. And I'm thinking, this is a hell of a lot of water, no wonder I'm constantly going to do it.
Exactly. So that might be an easy fix for you.
It could be, but I feel like I'm always thirsty as well. But nothing else is going on because I was chatterbox. That's really. Let's just admit it. This is why I'm drinking so much water, because I never stop talking. My girlfriend says you could talk the leaves off a tree, and thankfully, I think these are fake ones, so the leaves aren't falling off. So it's handy. But no, I hear what you're saying. So reduce that water. Hold on a little bit more.
Yeah.
To start trying to do some training. Yeah. So it's been noted that around 50% of women with bladder problems give up exercising due to leakage. What's your advice to them other than you can fix this?
Yeah, and it's really heartbreaking to see that. And you think about the benefits of exercise for general health, mental health, but I always think also as a role model for young kids. Like you see your dads being the sports coaches and your dad's going out to play and those sorts of things. And if the young girls aren't seeing their mums still going to play, it's sort of like, well, mums don't play sport, so absolutely do something. And as medical professionals, it's really common. So we know when you open up, they might be like, I've never heard this before. So common, but also really easy to manage for most people, and it doesn't have to be scary. So I think try and be brave and go and see someone.
Absolutely. For those listening who think they might benefit from seeing yourself or another pelvic physio, how do they get the ball rolling with all of this? Is it just straight to the GP? Can they self-refer for people who really don't know how this process
100%.
starts?
So absolutely, you can self-refer to a physio, which is great. And we might prefer or send you back to GP just to check a few other things if we think anything needs to be checked from a medical point of view. But absolutely, that's us. We have that ability to talk you through that. It is a area of physio that not everyone does as a physio, obviously. So you'd want to check in your area who does pelvic health and who is trained in pelvic health that can offer these services. But physios will know as well. So you could ask your local physio, do you know anyone that does pelvic floor? Where would you guide me? There's continence nurses, wonderful GPs, heaps of resources, Continence New Zealand itself. And from my sort of field, from a sport specific, the Australian Institute of Sport have got some amazing infographics and some amazing modules you can read up about as well.
Oh, great.
So that's really cool. I've done resources for Netball Smart. This is pelvic health for Netball Smart, sitting alongside your knee injury. So that's very cool to finally see. So it's all getting out there. So there's, have a read up, but also absolutely go and see if you can see someone and get the ball rolling.
And would you say to every woman should go and see a pelvic physio if they're in a financial position to, after they've given birth?
I would love that.
Yeah.
I think it's very empowering for a woman to have that. It's a big thing to go through. I guess down the track, if we can get all this education in even earlier, we might not need all this. But at the moment, there's so many women are finding out afterwards, they've given birth, that this is something that happens. So, in the ideal world, we'd see someone during pregnancy or even before. If someone's doing pelvic floor exercise in pregnancy, we know they're 50% less likely to have continence after. So that's a huge stat. But you get someone coming in really pregnant going, I'm meant to be doing pelvic floor, I don't know how to do it. It's a very hard time to learn how to do your pelvic floor.
Yeah.
So if you can come before that, get that muscle working really well, it's a breeze to do all the things you're meant to be doing. Or, coming straight after birth and not even know how to contract it, don't know what's normal for you or not. Whereas if you know what your body's like before and you've got those good connections and you can sort of recover. So before, after. all sorts.
I think it's fair to say that we are very reactive in this area of women's health, and I think your message and everybody that I've spoken to is we need to be more proactive about
100%.
this. There's so much we can do with prevention, isn't there?
Well, that's the thing. I mean, and the stats are just so obvious. Young girls that are leaking now are like 8 or 9 times more likely to have issues later. You're twice as likely if your mum's had problems. You've got your information. Are you hypermobile? Are you in your high risk things? We can sort of change that muscle in the way it's working early. That's them for life, rather than 10 years of bad use of a muscle. Trying to undo all the habits or do things differently again is really hard. So
100%.
It needs to be, it's not up to the young girls, it needs to be the people around them, the schools, the strength and conditioning, the gyms, the sports coaches, the environment that allows for those conversations to start being had, and then it will become more and more normal.
Yeah, and I was just going to say that teachers, PE teachers, mums, your aunties, grandmothers, get this message out to the younger ones, because we need to, that next generation,
100%.
to know this stuff, so that we're not dealing with what our age group is dealing with.
Yeah.
It's just so bad in our age group.
The biggest comment I get when we go into these big, like, professional sports groups, elite groups, they're like, why did I not hear this 15 years ago? So and I'm totally you shouldn't have to get to the top level and then hear it. You should probably get to the top level if you hear it a bit earlier. It might stop you from dropping out of your sport, or it might stop you from doing injuries.
But there's some really cool things available now, like the Squeezy app, which I've just heard about. So what can you do on there?
So there's lots of cool apps, and I do go to the Squeezy, because I'm familiar with it, but also because it's got a few customisable sort of options. So it's a wee app you put on your phone, and you set the times you want to remind yourself to do your pelvic floor exercises.
Oh, great.
But you can set how long you're squeezing for and how long you're relaxing for, because we often do like long holds or short holds and longer relaxes. And if you're trying to count away how long am I holding, how long am I relaxing, you can't focus on what you're doing. So there's a wee, like a little teardrop that you watch as it goes up, and a teardrop you watch as it goes down. And you can look back, because my patients say, like, I've done it most days, and they'll look back on the app like, I did it once that week. So it holds you a little bit accountable as well of actually how much you're doing it.
That's a great idea.
So it's
now there's a couple of places people can see you. You have a website called leto.co.nz. Would you like people to go there mostly to be?
Yeah, Leto, and that links me through to, I work clinically at Greenwood's Physio, which is here in Auckland, and then also with my colleague Neve, who's Christchurch, that's where we do all our education to sports groups and schools and a lot of other sports teams through the education side, and that's Pelvic Plus. So
if you'd like to get the ladies along to speak to your group, then absolutely get in touch. So Pelvic Plus on Instagram, I think, and then the other two websites are Leto and leto.co.nz, and then Greenwood's Physio in Auckland. Becs Dodson, anything else you'd like to add before we wrap it up today?
No, just try and be brave. The girls are great. Like the talks I have with them, that they're really open to it. And I've got teenage girls, and I'm used to the eye rolls and those sorts of things. But actually, I've got to give them credit. They're really taking it on board, and it's cool. So hopefully we get the message out there.
Good. Well, it's all about being proactive and not reactive, isn't it?
Absolutely.
Yeah, we've learned that today. Thanks so much, Becs Dodson, pelvic physiotherapist. And everything, you are superwoman as far as I'm concerned. But if this episode has resonated with you, please share it with a friend, teammate, daughter, mum, niece, because we want to keep this conversation going. Remember, the team at Continence NZ are available on the helpline. So if you want to talk to someone anytime, 0800 650 659 as a free confidential advice line. Reach out, because you're not alone. I'm with you. Becs is with you. Everybody's with you. Thank you so much for joining me on the Pelvic Pod. I'm Jen Bainbridge. Catch you next time. Mā te wā.